Hello and welcome. I'm so thrilled to be here at the Health Equity Summit and so honored to be among such distinguished speakers. I want to especially thank Robert Wood Johnson Foundation and the Commonwealth Fund for making this conference a reality. And I want to thank the conference organizers, Global Healthcare, for giving me the opportunity to provide stories, examples, and data related to how domestic violence is a health equity issue we should all be addressing. I'm Debbie Chang, President and CEO of the Blue Shield of California Foundation. And for the last 2 decades, we've been working to end domestic violence and advance health equity. We've learned that to break the cycle of domestic violence that can span through generations, we need to find ways to stop it from occurring and reoccurring. That means getting to the root cause to prevent domestic violence in the first place. It also demands a more expansive view of domestic violence, one that includes financial and housing insecurity, for example, as well as physical and mental health. You might be wondering, well, what does this have to do with health and healthcare? Well, social factors influence health, including the conditions that enable domestic violence. As you know, in healthcare, it's vital to treat the immediate needs of patients, but attention must also be paid to how we prevent poor health in the first place. The very same is true for domestic violence. We have to look at the systems that drive it, and we have to invest in prevention. Only then can we take the solutions that work and apply them at a population level so that many more families will see their lives improve. The foundation is investing in just this type of scaling. And the good news is that domestic violence can be prevented by changing the systems that allow it to thrive. There are 3 things that we're going to cover in our time together. First, expand your understanding of domestic violence and the social forces that drive it and how it relates to your work. Second, demonstrate how individual lived experiences can inform change at a population level by sharing the story of a survivor. And finally, I'm going to discuss policy strategies and opportunities that promote equitable and lasting solutions and prevent domestic violence. So today, let's broaden our thinking about domestic violence together. It's much more than a problem between 2 adults. To do this, I'd like to share a bit about my own experience and how my thinking has evolved over my 34-year career. Working across public health, policy, and healthcare sectors, I didn't always see domestic violence as a high priority health equity issue. I thought it was simply a private issue between 2 people. So why does that matter? If you think domestic violence is just a private matter, it's hard to see it as a public issue that requires attention. But if you see it as societal forces that shape people and how kids exposed to domestic violence are more likely to become victims or eventual harm doers, it becomes evident that we're all vulnerable to these forces and that we must take action. You see, domestic violence lurks beneath the surface and is intentionally well hidden. I've met with experts and heard countless stories of those exposed to domestic violence, and I've come to see that its impact reaches far beyond the home. In fact, whether you realize it or not, domestic violence affects your work and our communities through its complex relationship to numerous social issues such as homelessness, economic insecurity and poverty, gender equity, and more. So how exactly do we define domestic violence? We need to know this so that we can understand how to address this complex problem. Domestic violence can take many forms. It can be emotional abuse, intimidation, coercive behavior, control of finances, or even educational or employment sabotage. In many domestic violence situations, financial abuse and control also occur. In fact, 99% of survivors who experience domestic violence experience what's called economic abuse, which includes a survivor needing to ask their abuser for money or having no say in whether and how they can spend it. This means survivors often don't have control over their own paycheck, bank accounts, or credit cards, even ones that they themselves set up. And domestic violence affects more than just the individual. The physical, mental, and emotional repercussions can impact multiple generations, extended families, and entire communities. Exposure to violence is a trauma that can affect children and loved ones forever. This compels us to take a life course perspective. That means broadening our view to identify the multiple points across a person's life where violence has an outsized impact on health, safety, and the ability to thrive. For example, 50% of children who are exposed to domestic violence are below the age of 6. So addressing domestic violence with young parents and their young children is crucial. Intervention in the adolescent years is especially important to prevent poor outcomes and interrupt the cycle. So you see, there are many crucial points across a person's life where the risk of domestic violence can be reduced. So now let's address the social determinants. Those affected by domestic violence also carry increased risk of long-term health issues, homelessness, and economic hardship. A staggering 57% of women who have experienced homelessness report domestic violence as the immediate cause of their homelessness. Though homelessness is recognized as a crisis in this country, it is rarely linked to domestic violence. Without understanding how these two issues connect, both problems will persist. Finally, it's important to reinforce that domestic violence is a result of more than toxic relationships. Domestic violence is rooted in deep-seated gender norms, income inequality, housing instability, and cultural misperceptions. Inequitable access to housing, living in communities with low incomes, and limited access to job opportunities or quality education all lead to higher rates of domestic violence. In fact, domestic violence is 3 times more likely among financially stressed couples, and 3 in 4 victims stay in abusive relationships because of limited resources. So as you can see, domestic violence can be both the cause and the outcome of underlying problems. It can be the cause of homelessness. It can be the result of financial stress. Only by addressing its root causes can we hope to end the cycle across generations through healing and prevention. So what's driving domestic violence? We must clearly answer this fundamental question before we can begin to find solutions. First, there are economic factors: not having a safe place to live, not being able to earn a living wage, not having control over your personal finances, not being able to provide for your young children. Second, there are inequities driven by unhealthy gender and cultural norms and systemic racism. These injustices show up across society, in employment, in healthcare, in access to support services, and throughout the criminal justice system. All of these factors are root causes that contribute to domestic violence. Third, childhood exposure to violence can start and continue the cycle of domestic violence. Each year, 1 in 15 children are exposed to domestic violence before the age of 14. Children who witness violence in the home not only face worse health outcomes and developmental challenges, they are also more likely to experience domestic violence as adults. The cycle is perpetuating. Indeed, a predeterminant of violence is violence. Together, these hidden connections lead to an astonishing rate of domestic violence. Nearly 2 in 3 adults in California, 58%, are affected by domestic violence, either directly or indirectly through a family or friend. And we know that many people never report such violence. So this is likely an underestimate. Not everyone is equally affected. Black women are disproportionately at risk, as are women who are experiencing homelessness, and those who are members of the LGBTQI+ community. To change this, we must uncover survivor and community-driven solutions that incorporate the perspectives of these populations, and then back them up with system and policy level changes, which I'll discuss later. This brings me to why domestic violence should be a part of your work too. This conference has brought together a broad range of experts. You may work in the front lines or in public health administration, or you may be an educator or a policymaker, or you may be a health funder like I am. In any case, domestic violence is a part of your work because of its interrelationship to other deeply rooted social problems. If you're in healthcare, women you are seeing may be contending with domestic violence. That's a challenge and an opportunity. If you're in public health, the communities you are serving are ones where domestic violence is already a hidden fact on the ground. You can address this intentionally or let the status quo remain. If you're a policymaker, this is more important than ever before. You already know about policies that directly affect domestic violence, but policies related to homelessness and banking and a myriad of other issues are also policies on domestic violence. The policies you are developing will either maintain the status quo or will change these conditions and enable sweeping changes. You, the leaders in this virtual room, have the opportunity to design systems, institutions, and cultural spaces that could help protect individuals from the risk of violence. And the good news is that changing our financial, housing, and health systems is possible, especially now. The pandemic has exacerbated inequities, but it has also brought to light just how important it is to rebuild these systems. And we are seeing more public support as a result. This brings me to my second major point, how an individual's lived experience can inform change. At the foundation, we've come to realize that economic security and mobility are root causes of both health and domestic violence. And nothing illustrates that more clearly than the lived experiences of real people. So I want to share one such story of a survivor shared by one of our grantees, the Downtown Women's Center in LA. We'll call this woman Martha. Martha was a young working mom in LA with 3 young sons ranging from ages 1 to 6 years old. After years of escalating violence from her husband, she decided to take her children and leave home. Martha had a car and a low-paying job, few resources, and even fewer options. Her attempts to stay with relatives and at a shelter were unsuccessful. So she made the wrenching decision for her family to live in her car. And she knew it wasn't safe to live on the street, but she felt she had no other choices. After numerous interactions with police for living on the streets with her children, her kids were taken away, citing failure to protect, which is a common problem from domestic violence survivors without resources. Homeless and distraught, Martha became depressed and started using drugs for the first time in her life. Things got worse, and she lost hope that she would ever get her children back. That's when Martha met outreach workers from Downtown Women's Center. They housed her temporarily and connected her to supportive services. With their help, Martha got clean, got a job, and found permanent housing. Best of all, she got her children back. Martha's terrible dilemma reminds us of how interrelated these issues are. Leaving the abuser meant abandoning her financial security and leaving her family homeless. Her story reminds us that domestic violence is a result of deeply rooted problems such as homelessness and economic security, but can be a cause of them as well. A root cause highlighted in Martha's story is economic security. Bolstering the financial position of survivors is both a prevention strategy and an immediate intervention. For instance, reducing financial stress on families provides a pathway to decrease relationship conflicts and dissatisfaction, which are strong predictors of domestic violence. Also, by reducing financial dependence on an abuser, survivors have options. They can build autonomy and eliminate their reliance on unhealthy relationships. In fact, the number one reason survivors who want to leave a relationship stay in or return to abusive relationships is that they can't afford to leave. Another one of our grantees, FreeFrom, is leading work on this issue of financial security for survivors and directly addressing economic abuse. FreeFrom is a Los Angeles-based nonprofit founded in 2015 by Sonia Passi, who is the CEO. Let's take a moment to hear from her about their work and commitment to supporting the economic well-being of survivors. Sonia uses a more specific term of intimate partner violence, or IPV, rather than domestic violence in this video.
FreeFrom is a national organization on a mission to create pathways to financial security and long-term safety with and for survivors of intimate partner violence. 1 in 4 women and 1 in 2 trans folks in the US will experience intimate partner violence in their lifetime. And the number one obstacle to safety for survivors is financial insecurity. Why is this? Well, 2 reasons. First, the CDC estimates that intimate partner violence will cost a female survivor an average of $104,000. And on top of this extraordinary cost, 99% of survivors experience economic abuse as part of the intimate partner violence. And economic abuse can look like anything from not being allowed to work, being forced to quit your job or lose your job, having bank accounts in your name that you don't have access to, being given an allowance, having to explain every last cent that you have spent. I'm thinking of a client who came to us because 2 years after she had divorced her harm doer, debt collectors started calling her. And she learned very quickly that she had 7 credit cards in her name with $17,000 in debt that had remained unpaid for 2 years. And she had never seen those credit cards because the credit card statements every month were being sent to her harm doer's brother's house. And most of the charges on those accounts were made when she wasn't even in the country. I'm thinking of a survivor who was monitored financially to such an extent that when she went to her harm doer and asked for money to buy tampons, her harm doer responded that by his calculation, she had at least a week left until her period, and so she must be lying. Financial security is critical to survivors' long-term safety, health, healing, and wellness, and to the safety and wellness of their next generation. And the foundation has invested in so many new innovations at the intersection of intimate partner violence and economic security through our work here at FreeFrom. Intimate partner violence is a structural economic issue with financial causes and financial consequences. And in order for us to truly end intimate partner violence, we all need to take accountability for the problem.
The stories that Sonia shared provide a glimpse of the economic effects of domestic violence for survivors, their families, and communities. So what's the public appetite for change? To add a bit more context, COVID-19 has underscored the deep connection between people's economic situation and a rise in domestic violence. Stay-at-home mandates meant that survivors were isolated with their abusers, compounded by the financial stress, which translates into relationship stress. Domestic violence became a horrible reality for too many families, particularly in communities of color. That's why the foundation commissioned a survey that gives voice to their experiences with race, health, and conditions that cause domestic violence. I encourage you to read that study in the Summit portal resources. These findings show how last year has exposed and exacerbated deep inequities, but it has also raised awareness. The survey found that 91% of Californians view domestic violence as a serious societal issue. This brings me to the final part of our time together, where I want to share policy strategies and opportunities for positive change. First, let me stress, solutions such as jail time and involving law enforcement do not get at the root cause of domestic violence. Instead, we must make sure the whole family heals. That includes the child exposed to violence as well as the harm doer, so that the cycle of violence is broken going forward. Californians strongly support alternatives to jail for those who cause domestic violence and assistance for those who experience, such as help with childcare, food, housing, transportation, and even cash assistance. When families impacted by domestic violence have what they need to heal, it will end the cycle. Healing is prevention for the next generation. And to enable healing and prevent domestic violence in the first place, the systems need to change. Reflecting on Martha's story, her recovery actually illustrates the broad range of options available to increase her economic security and mobility so that she and her family could stay safe. Public and private systems, such as our housing, employment, banking, and criminal justice systems, must be more responsive to the priorities and needs of communities most impacted, including women like Martha. So I want to share with you 4 policy opportunities for systemic change. I hope these ideas help you to see the possibilities within your own community and at the federal level. They are, number 1, leveraging Medicaid for domestic violence prevention and applying a life course perspective under Medicaid. Number 2, home visiting to support both parents and young children. Number 3, providing flexible financial supports to reduce homelessness. And number 4, changing economic policies to support families at risk, such as tax credits and other income strategies. So first, Medicaid can be leveraged to increase its range of services to reduce risk factors that lead to domestic violence. The Foundation's life course research that I discussed earlier taught us that factors like early exposure to violence and the influence of peer groups can greatly increase or decrease risk. Social services must intervene early enough to address these root causes. At the state level, this could mean creating a plan under Medicaid to provide a range of services such as counseling, behavioral health, and family support. If such plans were implemented, Martha and her family could have been spared deep pain. And it can't end there. Martha needed services that couldn't be found in a hospital or clinic. She was among the 80% of Californian survivors of domestic violence who say that having a safe place to live, being financially stable, achieving personal freedom, and holding a steady job are very important to helping them feel safe. If state and community partners can better understand and address the non-medical needs of survivors, such as housing, food services, childcare, and transportation, survivors can continue to work and thrive. This is the idea of buying health, not just healthcare. In North Carolina, for example, the state secured a Medicaid Section 1115 state waiver, creating Healthy Opportunities pilots. This provided evidence-based non-medical interventions to Medicaid enrollees, including the identification of domestic violence and providing supportive services. As a former Medicaid director, I recognize that Medicaid can and should play a role in intervening early along the life course, not just in providing medical care, but in vital non-medical support services. And the Centers for Medicaid and Medicare Services, CMS, should encourage states to include preventing domestic violence in transformational efforts related to managed care and Medicaid state waivers. Second, home visiting programs can provide parents with life-saving support throughout pregnancy and in their child's first years of life. This two-generation approach, where the child and parent needs are addressed at the same time, has tremendous potential to break the cycle of violence. For Martha, home visiting could have made all the difference. The early years are a crucial time to identify risk factors for both poor health and domestic violence. Backed by extensive evidence, home visiting can increase families' economic self-sufficiency and foster healthy child development. But despite state investment and support, home visiting is not widely available. I'm pleased to say that the American Rescue Plan included an additional $150 million in emergency funding for the federal maternal, infant, and early childhood home visiting program. This influx of funding could increase its spread and adoption. This is a start, but more can be done. We need joint federal and state efforts to ensure families with low incomes have access to in-home support. Beyond Medicaid and home visiting, the third key opportunity I'd like to discuss is how housing policies can also work to prevent domestic violence. We know that more than half of women experiencing homelessness are survivors of domestic violence. For the Marthas in our country, these two problems are all too closely related. To address the link between these two issues, the Domestic Violence Housing First model, first developed in Washington State, dedicates funds from the Federal Victims of Crime Act to provide flexible support directly to survivors so that they can avoid homelessness. This program is now in 65 sites across California. Last year, the foundation released an evaluation of California's Housing First domestic violence model. 58% of survivors used financial assistance to prevent homelessness by staying in their homes or finding new housing. The agencies used the balance of the flexible funding to meet survivors' other needs, such as for transportation, employment assistance, and legal assistance. Flexible funds were used to solve small but urgent issues, such as repairing a car so that a survivor could keep a job. It isn't just a rent payment that can prevent a survivor from rebuilding economic security. The success of Domestic Violence Housing First in California paves the way to expand the program throughout our state and the nation, using new federal funding available for housing. Housing is also an area that the CMS Innovation Center, or CMMI, is testing in transformational ways to prevent illness and potentially to save money in healthcare costs. Not only should this work continue, but I recommend that CMMI extend it to include domestic violence. Fourth, and finally, to address a key root cause of domestic violence, economic security, tax credits for families are essential. We know that income is related to health. The pandemic shined a bright light on the inequities by income. Wealthier people fared better on so many levels. They were able to work, earn a living wage, and they were less exposed to health risks. We recommend increasing state and federal investment in earned income tax credits, child tax credits, and income policies that provide flexible, unrestricted cash to families with low income. So now it's abundantly clear that domestic violence is a health equity issue that requires a broad range of solutions to ensure healing and prevention. Domestic violence is a product of complex social forces that are beyond the control of individuals. It is both the cause and result of deeply rooted social problems and cannot be solved until this broader definition is embraced. Traditional approaches were narrowly focused on meeting the crisis moment for survivors. They leverage existing but separate systems and institutions to develop solutions. The systems are siloed, and therefore the solutions are siloed. What I mean is that the domestic violence system cares for survivors. Child welfare cares for the kids, and the criminal justice system handles the harm doers. But families don't exist in silos, nor do they heal in silos. Instead, I invite you all to embrace your role in seeking comprehensive and interrelated solutions that address the root causes of domestic violence and focus on prevention. Those solutions must reflect communities' assets, needs, and challenges, with a focus on strengthening the lives of families as we address domestic violence and health inequities together. Thank you very much.